The following program contains medical procedures. Channel 9 recommends parental guidance.
Turn the head this way, let's come right back.
Tonight on RPA, Denise looks for an answer to all those dizzy spells.
By this stage, you okay?
Sporting injuries put a first-year resident to the test.
You have got a broken nose.
And doctors probe Margaret's brain in the hope of curing her epilepsy.
Okay. You know, the purpose of the test today is to find out which side of your brain language is on, and also to find out how your memory function is working on the two sides. Okay. Because sometimes epilepsy can impact on memory so that one side might not be working as well as it should be. We want to make sure, first of all, that if you go on for surgery, that there's no risk to your memory and there's no risk to your speech function. Today we're going to put a drug into half your brain, which will put half the brain to sleep for about 5 minutes, and while it's asleep, we'll test your speech and we'll test your memory functioning. Once that wakes up again, we'll test the same things on the other side with the other half of the brain asleep.
It'll take a while between the two, is that right?
Yes, we're going to wait about 15-20 minutes between the two so that we make sure the drug is completely worn off one side of the brain. Also, I'm going to show you some things that I want you to remember after the drug's put in. All right? All right, then. What's your name? Can you say your name? Margaret, can you tell me what that is? What is that thing, Margaret? That's a chair. I want you to remember that, a chair. Here, take this in your hand. Take that. What is that? Can you say stapler? I want you to remember this. Remember a stapler. Margaret, wake up. What's this thing? Can you say key, Margaret? Remember that, a key. Very good.
Hi, James. Oh, I'm sorry. My name's Tage Dougal. I'm one of the residents here. We've seen your X-ray and there's nothing broken. Okay. So that's the first good point. Just tell me a bit about how you actually did it.
Well, I was playing basketball and I stood on someone else's foot and rolled it towards the outside.
All right, so your actually foot went inside, or your actual foot went on the outside?
Yeah.
You're definitely not sore on the knee, hips, anywhere else?
No, everything else is fine.
Just bend it. Relax. Fantastic. All right. Going to be on crutches probably for about at least 3 or 4 days, I would think, before you can get off them.
All right.
Put you on some simple painkillers. And Panadine. Fought initially in Panadine. Are you driving?
No, I'll get my brother.
Okay, because you're probably not a good idea to drive on your own. You'll be pretty dopey.
Okay.
You may have a praying, so don't drive. Keep that foot with ice, like beans and frozen vegetables and stuff. Just whack that on. No, keep it on for about 30 minutes. Leave it off for about 10-15 minutes. Particularly tonight and particularly tomorrow, frozen vegetables. Okay, good. Okay, I'll take that really soon.
And you think that you understood most of what I was saying, or do you think there might have been some time when...
I think I understood what you were saying, yes. But I couldn't do what you were telling. Now, a couple of times I couldn't even understand what you were saying.
Right. All right, I'm going to ask you about some things, see how well you can remember what I showed you during the drug's effect. Okay, I'm going to give you a couple of choices. Let's see if you remember seeing any of these things. Take this in your hand. What is that?
Looks like a felt pen.
Did I put that in your hand today?
Not that I can remember.
Fine. Take this in your hand. What's that thing?
Stapler.
Did you see that today?
Did I see it today? I'm not sure. I think you might have held it up to me, but I'm not sure.
Okay, it's a possibility. And what about this thing? Did you have that in your hand today?
Not that I can remember, no.
If you had to guess one of those 3 things, which would you say it was?
Only the stapler, but that's just a guess.
Okay, fine. How about some little pictures that I showed to you today? Do you remember what those were? Some pictures of objects.
No, I don't remember that.
Okay. No pictures at all come to mind?
No.
Take a look at these. Do any of those look familiar?
No.
None of them at all seem at all familiar.
No, I mean, I saw a key, but I can't remember seeing a picture of one.
You think you saw a real key?
I think so, but I'm not sure.
Okay. Okay. Okay, that's fine. Well, that's the completion of the first half. I'm going to do the same thing with injection to the other side of the brain.
All right.
Okay, you did real well on that first part, so the second half should go well. We'll just fit you for your crutches.
We'll try those ones. The bigger ones for the two. Just put them up there. Now just stand straight. So there needs to be some space there because you don't want to cause auxiliary nerve damage. Use all the pressure on your hands and just use that as a bit of support. Don't fully lean on it. Which might cause damage onto your arm. How does that feel?
It's fine. Yeah.
Fine, right side.
Yeah.
It looks right anyway.
Yeah.
You can adjust it with those if need be.
Okay.
Okay. And that's it from us. Here's your tablets. How are you getting home?
I'm going to ring my brother up.
Okay, do you want to use our phone just here?
Yeah.
Okay, I'll take you out to here.
Just remember to keep your head as still as possible there. You're in the right position there.
Have you got more classical music than that?
Can you find a classical station for him?
But too loud.
That's okay, Ola. There you go. Are you right there now? Okay, there you go.
This is the face in the front. And the ears are on the side here, and it's going right to the top of the head. There are the eyes there, with the optic nerves. Okay, now unfortunately we have to do a few more scans. Do you think you're going to be able to cope with it?
Not ones like that one.
No, it's not going to be 20 minutes. The next one is going to be like a 10-minute one, and the one after that about an 8-minute.
Well, that's all right then.
Now, Denise, you've been having some problems with vertigo or dizziness. You've written me a letter, and so has your doctor in Hobart, about your problem. Would you like to tell me about the particular trouble you've been having?
Yes, well, I've had dizzy spells as such for many years. In fact, looking back, I'd say probably from when my children were young, which would be more than 20 years ago. Dizziness in that, in motion particularly, I've always been motion sickness, seasickness, air sickness. It's been getting progressively worse in the last few years. I've been treated for vague ear infections and so on, which may have caused the dizziness. But in the last 12 months, and particularly the last 6 months, it's been getting so bad that I'm almost living with dizziness all the time.
Right. Would you like to describe to me a typical sort of event of severe dizziness?
Yes, well, for instance, if I evenings at night time, I don't lie down too straight to sleep. I can't lie flat.
Yes.
If I have a bad night where I'm restless, when I try to get up in the morning, I'm very, very giddy and dizzy, which lasts for a few hours. I'll tend to topple into walls, and if I'm lifting my head back to reach for something, or if I'm bending over to pick up something, I'll topple to the right.
So if you're getting something out of a top shelf, for
Yes,
instance, you may have to look up and you get very giddy. You'll have to hang on to the
Yes.
cupboard or something.
Yes, or I will fall. Mm.
Right.
Right. All right, so what happened?
I came in to tackle someone from behind with the stick, and they swung around and clocked me in the head.
Right. And have you had any nausea, vomiting?
No.
Any headaches? And
A bit of a throbbing headache on that side.
On that side, okay.
Yeah.
And was it a hard hit?
Yeah, it numbed me a bit, and I couldn't see out of that eye for a while.
Right,
Like, it's just at the time.
Right, okay.
Yeah.
Right, I'm just going to feel around your eye there. If you can tell me anywhere where it's painful at all.
No, it's fine. Yeah.
Just painful there? Sorry.
Yep.
All right. Okay, so I'm just going to put a dressing on there and we'll get you sorted out. All right?
Sounds good.
Okay. That he's got he's got a small fracture on his septum. So I'll hand him over to you because basically fractured nose aren't within the nurse practitioner's realm. I'll suture him up, however, and then you'll just need to do the rest. So I'll just document it that I've handed him over. Okay, thanks.
Paul, you have got a broken nose, broken about 4 or 5 little tiny little bits. But looking at it now, it looks pretty good. And the main thing is that it's in the middle, and it's not too swollen or deviated. It's not like... Yeah, I think you're lucky. I think it's just smashed a bit, but it's all the alignments remain the way it should, rather than being distorted severely. The same thing, like I said before, though. Look at yourself in a couple of weeks down the track when all the swelling's gone down, and everything looks normal. If it looks fine, then leave it at that. Just don't worry about it. If you're kind of concerned about it or it doesn't look right, come back and we'll smash it up again and fix it up for you. That's how we do it. Not quite serious,
Oh, fair enough.
All right. So if you don't want to have a broken nose second time around, make sure it looks good.
Now, what I'm going to do now is I'm going to drop your head back, keep your eyes open for me, and if you feel dizzy, you tell me. I'll hang on to you. You won't fall, okay? It's just a matter of observing your eyes. So let's turn your head to the right first. We'll take you back quite quickly. 1, 2, 3. Open your eyes. You're getting a little bit of giddiness there?
Yes.
Yeah. Tell me when that's just about settled now.
Yes.
Just about gone, okay? Sit up for me. Now you may get giddy when you sit up. Okay, keep your eyes open for me. Feel giddy at the moment?
Yes.
Yeah, just stay there. You've learned to look at something fairly intently. Suppresses the motion of your eyes, and that certainly helps, doesn't it? All right. Tell me when you feel okay and I'll test your left ear, because this is the way we differentiate between the 2 ears as the cause of the problem.
Right.
You feel okay now? Okay. Let's turn the head this way. Let's come right back. You don't feel giddy there?
No, just slightly.
But nothing like the other side? No. All right. Sit you up again. Keep the eyes open. By this stage, you're okay? The answer is no, you're not okay, but I'm hanging on to
Thank you. I'm basically just gonna put about 3 or 4 sutures in that. They're just small ones. Now I'm gonna leave the length of the sutures fairly long because the suture material is almost the same colour as your eyebrow. So.
Oh, okay. Can I get that wet or?
No, you've got to keep it clean and dry. What I suggest you do, just when you wash your face, just towel dry it. Okay. The wound's all together nicely now, actually. It's worked out pretty well. You've just got the 4 sutures in there.
Yep.
So when the doctor asks you how many there are, and he says he's only taken the 3 out, just say yes, there are 4.
Yep.
Happy to say everything's really gone a lot better than I expected it to have done. We have enough information to be able to say that there is an answer to the problem with an operation.
Oh, that's good.
It's interesting that the MR scan, which you've had only recently, shows quite clearly that there is a tumour, which is a benign thing, is in that left temporal lobe. We're happy from the EEG information it's responsible for the epilepsy. And that is the reason, of course, that you have such a problem with your memory. And we're completely happy that the other side of the brain, on the right, is able to carry on normal memory function if the surgeon operates on that left side.
This means I'll get my memory back.
It's hard to say the memory will ever return because I think the damage has been sort of going on ever since the tumour was there. It's a relatively safe operation, but obviously there are some hazards of infection or of a stroke occurring, but they're under 1.5%. So I think that the possible benefits outweigh the risks.
Oh, that's right.
Oh, yes.
And
a huge difference.
I'd have thought it's hard to put a figure on the likelihood of a cure, but there is an 80 to 85% likelihood that you will have no fits and no need to have anticonvulsants.
That's really good.
No, that's really encouraging. It's better than we hoped for with something.
Oh, it's better than I
so, yeah, something so as clear as that.
Yes.
Yeah.
Hello.
Hi.
My name's Dr. Dougal. I'm the resident here. I believe you've got a sore arm. What happened? What happened today?
I fall off the ladder.
Right. Okay.
I'm not actually fall by myself. The ladder slipped off the floor and went down.
All right. What were you doing?
And I tried to protect myself. I put my arm I protect my face.
Mm-hmm.
But still I get hurt here and close the arm.
Okay. What were you doing up the ladder?
Painting.
Right. Is that what you do for work?
Yeah.
Okay.
Living.
Is that what you do for a living? All right. How far up the ladder were you? Do you know?
I was the top part of the ladder was about 3.5 meters.
You've broken it.
Yeah.
These are the X-rays that have already been taken of you. You have smashed it. There's a bone in there, the head of the radius. There's two bones, a radius and an ulnar, the two main bones in your forearm. The radius has a little head on it that's involved in the twisting of your arm. That's what you've broken. Now, if you can just see them from here. Okay, put this way. This is the radius.
Yes.
That's the fracture right there in the head. Similarly, the fractured head right there. It's actually a significant injury. If that was just broken and it wasn't split, it would be okay, but because it's separated so far, we're going to have to take you for an operation and put a screw in it and try and fix it up.
That's got to be permanent screw.
Yeah, screws there for the rest of your life. You're right-handed or left-handed?
Both.
Okay.
The paint I needed 2 hands.
Needs 2 hands?
Of course.
Well, you only got 1 hand for a while.
Now it's only one. What you can do? To hold the ladder, or to hold the paint, or to hold the ladder to climb up.
Yeah, okay. I think you're going to be off work for a while. You got anything else to keep you busy? What are you going to do in your meantime?
When?
When you're off work?
If I stay home, that's all what I can do. I can do nothing else.
Mrs. Hall's problem is that she has a tumour in the middle part of her brain, in a part called the temporal lobe. The particular challenge that we face in this case is removing the tumour while preserving the parts of the brain adjacent to the tumour that control the speech and memory. And that's why this case is particularly difficult. We can see the tumour now in the bottom of the ventricle, and what we'll do is break it up into tiny fragments and suction it away with the ultrasonic aspirator, and that should allow us to remove the tumour whilst preserving the vital structures around it. The removal of the tumour looks very good, and we'll close the craniotomy wound now. At the end of the operation, we'll be able to assess her by talking to her and work out whether her speech and memory function has been preserved. However, it'll take a year or two before we can be sure whether we've improved the control of her epileptic seizures with this operation.
Hi Margaret, how are you feeling?
Good, thanks, Dr. Walsh. Good to see you.
You remember my name, isn't that excellent? So your memory hasn't been all that much affected?
Oh, no.
Good. Well, it's about 48 hours, isn't it, since you had the operation?
Yes,
now?
it is, yeah.
Now, how are you feeling in yourself?
I've still got a few hurts around my head, so around here on my head, and a few places up around here. This is all right, all down here. It's going quite well. Down here it's hurting a fair bit, and up around the top of my head it's hurting a fair bit, but we're getting there.
So the operation went extremely well. I've spoken to the surgeons about it, and as you know, as a rule with this type of epilepsy, the whole of the temporal lobe's taken out, but in your case, because there was a tumour on the inside edge of it, they did a careful dissection around that and only took that inner bit out, leaving all that side part. So I think that there ought to be little effect on either your memory or your concentration.
I've really done an excellent job with it. Really good.
So the plan is we're going to leave you on your tablets and see what happens over the next 2 years. Now, if everything actually goes according to plan, I don't expect you to have any fits, and we'll see how we go with that.
It'd be marvellous if I don't have any problems with it as I'm going along. That it would be incredible.
And you even look a bit cheerful.
Yeah, things are going quite well.
Good.
Yes.
This basically is the outer ear canal, the bones of hearing, and here are the semicircular canals that tell us about balance. In your case, in this canal here, this back canal here, the posterior canal, some little crystals have found its way into that canal. Whenever we tip this canal, when you bend forward or back, like in bed, crystals can run around this canal because when it's sitting in that position, it's vertical, okay? And therefore crystals will run around the canal. When they do that, they excite the nerve cells at one end of the canal, and you get these violent bouts of dizziness. What we need to do is just simply defunction this canal by opening it, putting a little plug of your own blood mixed with a little bit of bone, put it into the canal, and it'll stop the crystals moving around the canal. And if the crystals don't move around the canal, you don't get dizzy.
Now, I'm just going to lower this bar.
Next week, Denise goes into a spin before doctors can cure her dizziness.
And just follow the lights across the bar. I'm going to get the computer to generate them across here, okay? Put him on the bed.
A crisis and emergency as a man wavers between life and death.
So you got a pulse? We need the O negative blood.
Pass
Get
syringe,
a syringe,
20
guys.
syringe. I couldn't go home. I was going to get a little cricket bat. And when the baby's born, put a little cricket bat in the baby's hand.
And obstetrician Greg Gard helps an expectant father.
You okay? Yeah. The red hat looks good. I like that. It's a happening look. It's a happening look. It's very good, isn't it? You don't have a hat. We've got to get a hat. We've got to get a hat.